College Gym Vids fan going live on YouTube. This is continuing my Asperger's Wikipedia video. That's my Hello Kitty wallpaper on my iPhone. The atypical antipsychotic medications, risperidone, olanzapine, and aripiprazole have been shown to reduce the associated symptoms of AS. Risperidone can reduce repetitive and self-injurious behaviors, aggressive outbursts, and impulsivity, and improve stereotypical patterns of behavior and social relatedness. The selective serotonin reuptake inhibitors, SSRIs, fluoxetine, fluvoxamine, and sertraline have been effective in treating restricted and repetitive interests and behaviors. Care must be taken with medications as side effects may be more common and harder to evaluate in individuals with AS, and tests of drugs' effectiveness against comorbid conditions routinely exclude individuals from the autism spectrum. Oh, I'm trying to see where I was. I lost my place. Oh, abnormalities in metabolism, cardiac conduction times, and an increased risk of type 2 diabetes have been raised as concerns with these medications, along with serious long-term neurological side effects. SSRIs can lead to manifestations of behavioral activations such as increased impulsivity, aggression, and sleep disturbance. Weight gain and fatigue are commonly reported side effects of risperidone, which may also lead to increased risk for extrapyramidal symptoms such as restlessness and dystonia, and increased serum prolactin levels. Sedation and weight gain are more common with olanzapine, which has also been linked with diabetes. Sedative side effects in school-age children have ramifications for classroom learning. Individuals with AS may be unable to identify and communicate their internal moods and emotions, or to tolerate side effects that for most people would not be problematic. Prognosis. There is some evidence that children with AS may see a lessening of symptoms up to 20% of children may no longer meet the diagnostic criteria as adults, although social and communication difficulties may persist. As of 2006, no studies addressing the long-term outcome of individuals with Asperger syndrome are available, and there are no systematic long-term follow-up studies of children with AS. Individuals with AS appear to have normal life expectancy, but have an increased prevalence of comorbid psychiatric conditions, such as major depressive disorder and anxiety disorders that may significantly affect prognosis. Although social impairment may be lifelong, the outcome is generally more positive than with individuals with lower functioning autism spectrum disorders. For example, ASD symptoms are more likely to diminish with time in children with AS or high functioning autism. Most students with AS and HFA have average mathematical ability and test slightly worse in mathematics than in general intelligence, but some are gifted in mathematics as has potentially been linked to some accomplishments, such as Vernon L. Smith winning the Nobel Memorial Prize in Economic Sciences. However, Smith is self-diagnosed. Although many attend regular education classes, some children with AS may utilize special education services because of their social and behavioral difficulties. Adolescents with AS may exhibit ongoing difficulty with self-care or organization and disturbances in social and romantic relationships. Despite high cognitive potential, most young adults with AS remain at home, and yet some do marry and work independently. The differentness adolescents experience can be traumatic. Anxiety may stem from preoccupation over possible violations of routines and rituals, from being placed in a situation without a clear schedule or expectations, or from concern with failing in social encounters. The resulting stress may manifest as inattention, withdrawal, reliance on obsessions, hyperactivity, or aggressive or oppositional behavior. Depression is often the result of chronic frustration from repeated failure to engage others socially, and mood disorders requiring treatment may develop. Clinical experience suggests the rate of suicide may be higher among those with AS, but this has not been confirmed by systematic empirical studies. Education of families is critical in developing strategies for understanding strengths and weaknesses. Helping the family to cope improves outcomes in children. Prognosis may be improved by diagnosis at a younger age that allows for early interventions. While interventions in adulthood are valuable but less beneficial, there are legal implications for individuals with AS as they run the risk of exploitation by others and may be unable to comprehend the social implications of their actions. Okay, I'm gonna stop here and do epidemiology next tomorrow.